I'm Chris Miezitis. I'm the co-director along with Cathy Sexton, who's here this morning at Fathers Network Scotland. And yeah, today is all about how we are supporting new dads' mental health in the Greater Glasgow and Clyde area. So could you skip to the next slide, please? There you go. So that's what it's all about today. And if we jump on to the next slide. So this is essentially what the agenda is going to look like today. We're going to hear a little bit about what the third sector's been doing in Greater Glasgow, have a wee break, and then hear a bit more about what the NHS, our NHS colleagues have been doing in the Greater Glasgow area. And as well as talking about and hearing about what's been happening, what's really important, I suppose, is that we think about, well, where do we go next in Glasgow? So, so we can build from all this work and move forward together, collectively, from what we've already achieved. So if we could just quickly jump on to the next slide. As you will see, we have a plethora of fantastic speakers. We are going to be hearing from Hugh Masters shortly, the chair of the Perinatal and Infant Mental Health Programme Board, and Michelle, the chair of Glasgow's Perinatal Mental Health Network. And then we're going to hear from all of our speakers, as I say, from third sector organisations and from NHS frontline staff who are supporting families and dads in and around the perinatal and paternal mental health agenda. And as I say, it'll be a great chance for you to hear what's going on, but also to ask anything you would like to ask. There's been a lot of work going on across Scotland over the past 3 years or so, 4 years maybe, around the paternal mental health agenda. And why are we thinking about Glasgow? Why are we talking about Glasgow? Well, in particular, there's been a lot happening in Glasgow, and it feels like the right time now to kind of consolidate the work that we've been doing, to bring everyone together, to pause, take a breath, and just think about what we're doing in Glasgow. How did we get here? Why are we doing this work? And as I say, where do we go next? So that's what today is going to be all about. And without any further ado, I'm going to introduce you to our first speaker. And we'll pass you over. Oh, I'm not actually. I want to ask you a question first. Sorry, I completely forgot about that. So this is an icebreaker question, but also it's a question that Cathy is genuinely interested in. She said to me once before a seminar we've been to, I've always wondered what people drink first thing in the morning. So this is Cathy's chance to really find that out. So if you could just chuck in what you're drinking this morning, I imagine there's going to be a lot of cups of coffee. So far, only 2 cups of coffee, lots of water, very healthy people out there, juice, tea, something else. Well, I won't ask any questions, but I'm not entirely sure I've had enough coffee yet today, but tea, coffee. It'll be interesting to see who wins over the tea and coffee battle. No hot chocolates yet, although that might be something else. So, oh yeah, it looks like coffee is just edging ahead in the tea and coffee battle here. Lots of people drinking water though. I shouldn't be surprised, but I am. It's very healthy. So, okay. So that's how Mentimeter works. It looks as though quite a lot of you are logging into Mentimeter and answering this question. So for those of you that are having any issues with Mentimeter, we have a chat function here. And so as we're going through the morning, you can use that as well to ask questions or to make comments. So if for some reason you can't go onto Mentimeter, just use the chat function. That would be great. So because I prefer coffee to tea, I'm going to stop the poll here because coffee's ahead and I want to stop it before tea catches up. So coffee's won this morning's first round. And we have another question, which I've had to read 2 or 3 times to actually understand, but I'll read it for you. So would you rather fight 1 horse-sized duck or 100 duck-sized horses? I think Cathy's just trying to get her brain cells working for this one. I can't imagine what it would look like to watch somebody fighting a horse-sized duck, but there we are. So I think it's pretty much 50-50 with this one, more or less. Oh, horse-sized duck seems to be people. It looks as though you would rather just take on 1 giant duck than 100 small ones. I imagine it'll be a bit like Jurassic Park. You're scared of the big monsters, but it's the hordes of small ones that can really hurt you, I suppose. So, okay, so there you go. So that's Mentimeter. That's how it works, and hopefully that's got your brain kind of kicked in. It's Monday morning, and I guess we're all just starting the week after whatever we've been doing this Father's Day weekend. So this has really been a wee chance to get our brain cells heating up a little bit. So anyway, without any further ado, I am now going to pass you over to Hugh Masters, who is the chair of the Perinatal and Infant Mental Health Programme Board. Over to you, Hugh.
Thanks, Chris. And yeah, I'm just recovering from that second question there. So I'll get my head back into this. Thanks very much for the invite. I will keep to time because you've got a lot of speakers, and the worst thing is if your first speaker goes over time. So I'll stop at 10 minutes regardless. So yeah, I'm Hugh Masters. I'm the chair of the Perinatal and Infant Mental Health Programme Board, and have been since we started that in March 2019. I don't have any slides. I'm just going to talk. I think you'll see enough slides today. So our programme of work was a 4-year programme, so it's due as such to finish in March 2023. But of course, that only refers to the programme board and the programme of work that is under that programme board. It's absolutely critical that we continue the work, needless to say. So our programme board initially was around perinatal, very focused, but it grew, and we were asked to take on infant mental health. And we try and couch our work now as being mental health from preconception through to 3 years. And as I go through this, I'll try and talk about fathers as much as our work has crossed over into that area, but some general stuff too. And I want to frame it in terms of where we are, which is very much thinking about towards March 23, and try and understand 3 key questions for the programme board. What have we done? What difference has it made, and what is still to be done? And I've got an ask for you at the end of that. I've tried to avoid listing it because it'll just become a list, but there's inevitably a bit of that. So firstly, what have we done? What have we delivered? Well, we've delivered £18 million worth of direct funding, new funding to perinatal and infant mental health. Obviously, some of that has gone to the third sector, wonderfully managed for us by Inspiring Scotland, and I hope they've been supporting all of your work, which I know they have, via the Mental Health Fund and also the Small Grants Fund. Lots of organisations represented here today have received some of that funding, so Home Start, Quarriers, Crossreach, Sure Start, and also, of course, DADx and Fathers Network Scotland. We've funded the development of statutory services, and again, we'll be hearing from one of the mother and baby units today. And the aim of that really is to be an increased staffing to take a real whole family approach, and we're already beginning to see some of that work really taking shape in terms of the mother and baby units really developing those pathways for fathers, and also there are plans to appoint peer support workers for fathers allied to the mother and baby units, and we hope that will be happening soon. So we've seen things like, through the increased funding for our nursery nurses, they're facilitating dads groups in the mother and baby units. They're facilitating buggy walks and dads learning about baby massage. So that's really been an important development, as has the mother and baby unit family fund, which we set up, which allows, we appreciate that these are 2 central Scotland units, and this fund allows fathers and others to be able to visit and have that funded in terms of transport and accommodation. We have now pretty much got specialist community perinatal mental health teams working across Scotland, and also increased funding for maternity, neonatal psychological interventions. And really, really excitingly too, we now have infant mental health services running in around about 6 boards. And the feedback from them is very positive and shows the need and the value. We funded a lot of work and developed a lot of work with NES around workforce, And this also includes that focus on working with the whole family, working with fathers, and that generic provision that's so important. The one I might pull out is the health visiting training that for developing perinatal and infant mental health champions for health visitors, another 120 to be trained this year. And of course, I know the Fathers Network are also providing excellent training in this area, and I'm sure we'll hear more about that. A couple of other things that we're going to be working with Fathers Network Scotland to better understand the evidence around mental health within the perinatal period for fathers and partners, and that's just in development at the moment. And really importantly too, as part of the programme board, we have two participation officers, and one of them, Kat Masterson, is focused on fathers and infant mental health, so she's really taking a very clear focus on that. The other thing we're trying to do at the moment is really make sure that we're making those cross-policy connections to things like Best Start, the drugs deaths work as well around supporting women, reducing harm, and really importantly to the mental health strategy, the new mental health strategy as it develops. So a couple of the other questions that we're trying to address in our work are, what difference is this making? Because clearly that has to be absolutely at the heart of this. So we're capturing numbers via the work that Inspiring Scotland is doing for us with the third sector. And we're also in the midst, finally, after having to cancel them about 5 times because of COVID, of doing actual face-to-face board visits and monitoring, and then following that up with meetings with executives, leads in the boards to understand fully what difference is it making, how many additional services are there, how many women are being seen, how many families are being seen. And we're also complementing that with a range of evaluation activities from Public Health Scotland. What still needs to be done? Quite a lot. We've done a lot, but a lot needs to be done. So we want to make sure that full rollout of services across third sector and NHS is in place right across the country. That was one of the primary reasons the board was set up. Third sector funding, we're right in the midst of looking at how do we ensure as much sustainability to that as possible. We know that's a huge issue for the third sector. And allied to those two, how do we integrate third sector and statutory together? So it's great to see today that work that is happening across Greater Glasgow and Clyde, and really interested to see how that's fanning out. The other things we're working hard on are regionality, so ensuring that there is specialist support across into rural areas and the islands. And as you'll know, we have a consultation that's just closed. We're just analysing the responses around the need for additional mother and baby unit inpatient provision across Scotland, and we'll be further looking at that over the course of this year before offering some conclusions around that. And I've already mentioned things around workforce and sustainability. So what difference has it made? Well, that's something that we're really pushing hard to understand fully. As I've said, the pandemic, all of the research that we've seen from Public Health Scotland, from Fathers Network and others, shows that really probably the impact on families with young children has been greatest during the pandemic. And I know from a personal point of view, my son had his first child during the pandemic and right in the midst of the biggest lockdown. And I think they're still recovering from that. There's still work to be done there. We've had lots of similar accounts of those issues. And I think, I congratulate, as ever, Chris, Cathy, Fathers Network, and this event, because it is a difficult and can be a sensitive and sometimes difficult and contentious area to talk about. It's culturally and politically loaded, and I hope as a programme board we've not shied away from it. And what we've tried to do is really put the baby, the infant, at the centre of all of our discussions, and then I think everything becomes a lot clearer. So I got a couple of asks for you today, I think, of everybody here. One is that there is a developing mental health strategy, and I would really, really urge you to make sure that hopefully you've put into the consultation So that's absolutely critical. And we want to see all of these issues that we'll be talking about today. If the new mental health strategy is about prevention, then this work has to be at the centre of it. The second is that as we do the report and we make recommendations to the Minister about how this work should continue, which is what we'll be doing over the next months running up to next March, I might ask the people here if you could do one recommendation for that report to go to the Minister and others, thinking about the importance of fathers and paternal mental health around this perinatal period. What might that be? And I'd be interested to know that. So I'm bang on 10, which is absolutely incredible for me. So thanks for that. I'm going to stay for the whole morning, so I'm very happy to answer questions whenever there's a gap. And I really look forward to hearing from everybody. So thanks very much.
Thanks very much, Hugh. So a fantastic introduction there in terms of just really kind of laying out the sort of general context and national perspective on the perinatal and infant mental health agenda and what's been happening and where we're hoping it's going to go. And a great ask there for everyone here today and for colleagues across the sectors to contribute to the conversation now, to kind of post suggestions and questions as to where we go from here and where we go beyond 2023. So now I can see by the slide that it's me that's going to be talking for the next few minutes, and I'll try to keep this fairly brief. So if you want to jump onto the next slide, Cathy, that'd be great, thanks. So yeah, I'm just going to tell you a little bit about Fathers Network Scotland and our involvement in the paternal mental health agenda, the paternal mental health conversation. Why did we end up thinking about this issue and what have we tried to do about it? So back in 2018, at that point, we had been doing a lot of work around the general issue of father inclusive service. So trying to support many of the types of services that are represented today in the sort of perinatal context to help them think about, in general terms, how can we become more father inclusive? How can we make sure that more whole families around the child are engaged in the work that we do? But around about 2018, on the one hand, talking to staff who are working on the front line, an issue kept on emerging when we were working with staff. And that issue was one of the challenges that staff kept on wanting to address was the issue of paternal mental health. And that seemed to be kind of new to us in the sense that it wasn't really something that had come through so strongly thematically previously. So it was on our radar. But in 2018, along with the Fatherhood Institute, we conducted a nationwide survey across the UK. About 6,500 dads took part in the survey, and 600 or so dads took part in Scotland. And we wanted to ask new dads what their experiences were of perinatal services. Now, I guess we were expecting a mixture, some good experiences, some not so good experiences, but I can still remember the day that Cathy and myself and the rest of the teams were sitting in the office, and we got the first results back from the survey after it closed, and we were all quite taken aback, quite surprised at the kind of information that we were getting back. Being completely honest about it, it wasn't painting a very positive picture. And there's just a little. This slide just gives you a little excerpt of some of the types of things that dads were saying. Essentially, dads were telling us that although they were there, although they were present, although they were coming along to this is pre-COVID, obviously, coming along to screening visits or being there to support moms when they gave birth and so on, and being there after the birth, dads were not really being asked the types of questions that they should have been asked. They weren't being asked to think about their health and well-being, about their role as a dad, about how best to support a mum. Many dads telling us that they weren't even being addressed by their name, that kind of thing. So dads, in general terms, were not feeling engaged all that well with services when they were there. But also when we thought about the sort of context of paternal mental health, which was being repeatedly raised as a challenge for staff on the front line, we knew what the stats were telling us, that around about 1 in 5 dads will suffer from depression, for example, around about the time of the birth of a child. But where we try to speak to every mum about her mental health when a baby is born, according to this survey, only around about 1 or 2 dads were being asked that question. You know, how are you doing? How's things for you? And that didn't reflect on what we knew the evidence was telling us, that Dad's mental health was really important, not just to him, but to the health and well-being of mum, the infant, the whole family. And we were really missing a big opportunity here. Dads were there, but they weren't being asked to think about these things. So it was a big miss, really. What could we do about that? So if we jump on to the next slide. Sorry, there's just a few more comments. These are just some of the things that dads were telling us, some of their own experiences. So there was one guy, for example, who had a camp bed in the shower so that he could kind of stay overnight and be there for the mum, that kind of thing. And dad's talking about how their own mental health had been impacted and that they hadn't had that support. So if we jump on to the next slide then, Cathy. So we recognised that Fathers Network Scotland, we are not the experts. We're not the experts in perinatal and infant mental health or on paternal mental health. So we wanted to bring together some of the experts, some of the key experts on a sort of national level and a local level across Scotland to talk about the issue, to think about it, to examine the evidence. And so we pulled together an advisory group. A few people of whom are here today to talk about really what is the evidence telling us and what can we do about that. So I guess we all agreed pretty quickly that the evidence is clear, it's compelling. The mental health of fathers is really important. We need to consider it. We need to support the mental health of fathers and good mental health of dads, get them help when they're maybe struggling and so on. But we're not really doing that. And what can we do about it? So one of the things that we agreed to do was to engage initially with the workforce out there, the massive workforce working on the front line in the perinatal and infant mental health context, and give the workforce the chance to not just think about the issue, not just to think about what the incidence of poor paternal mental health might be, but to think about their own practice and how it relates. If I'm a health visitor or a midwife, how does the issue of paternal mental health impact on me and my practice? Is it something, is it a new thing I have to think about? Is it going to be a big addition to the work that I'm already doing in terms of engaging with the conversation around paternal mental health? So we pulled together a workshop. We called it How Are You Dad? It's now called Understanding Paternal Mental Health. And that's essentially what we were trying to achieve there, these three kind of main aims there: to improve practitioner and service knowledge around the issue of paternal mental health, to improve confidence around the issue of dealing with the issue of paternal mental health, but ultimately to affect practice change, to better support the issue of paternal mental health, essentially, as Hugh touched on there, to better support that whole family around the infant. And really, we emphasised in our training that this was about very small changes, little things that we could do here and there, little adaptations to the work that we're doing that will make those big differences. Not rocket science. We're not trying to reinvent the wheel or create a whole new body of work. So if you could jump onto the next slide. We piloted the training across a few teams in Scotland, and essentially we managed to respond to what we were trying to achieve quite successfully. Everyone that took part in the training said that they thought that the training was something that they would recommend to their colleagues in terms of understanding the issue. The vast majority of participants were able to identify those small changes that they'd make to their practice, which is ultimately what it was all about. So we had a training program that worked, that seemed to address the issue for the workforce at least, and to help them think about how they would change and adapt practice. So if we jump on to the next slide. So where did we go from there? Well, COVID came along and we had plans to take this out across the whole of Scotland, but as with lots of other things, COVID put a stop to a lot of the work that we were doing. But in the last wee while, as Hugh had mentioned, we, along with a few others, managed to get some support from the Perinatal and Infant Mental Health Fund to sort of restart this training. And we've been going out across a few health boards, working with a lot of the new teams, the infant mental health teams, and the perinatal mental health specialist midwives and so on, mother and baby units, all these different types of teams, and focusing in on exactly that, looking at practice, thinking about the issue and small practice changes we can make. And what we've been able to do over the past wee while as well, because of the support from the fund, has been a bit more time with some of these teams, really digging into the work that we're doing and trying to think, how can we really make a longer term and sustainable change? And you're going to hear about some of the some of the work that other people are doing in the Glasgow area, some of that work which has been supported by this training. So that's where we are now. This is where we've got to. We're going to be continuing this work on until the end of this financial year, and we shall see where we go from here. So that's really why we've been looking at this issue and where we've got to now. So if you could jump on to the next slide, Cathy. So what we're going to do now is I'm going to introduce you to a guy called Ross Duns. Ross works for Hitachi Rail. He works very much in a sort of traditional, I suppose you could call it, a traditional sort of working man's environment, very masculine kind of culture that he works in. And his mum happens to be a health visitor who came along to one of our training sessions, and she knew that he had as he'll talk about, his own connection with mental health. He was a mental health first aider at work. So he came along to one of our training sessions, and then he spoke to us about his own experience of his own struggles with poor mental health, how it impacted on him and so on. So we're going to hear from Ross just now. If we can stick that little film up, that'd be great.
First couple of years, every weekend I'd be arguing. I used to work longer hours so I didn't have to come home, and it didn't really come to a head until Sophia, my second, was born. And the first couple of days, it's a whirlwind, so you don't have time to take stock. But I started to have sort of feelings like I didn't really want her. I wasn't bothered. Somebody could have came in and said, I'm just going to take her away. I would have been like, no bother, that's fine. And then I spoke to my wife about it at the time, and she said, I've known this for a long time. You need to admit to yourself that there is something there and go and get help. The stigma that I had created in my own head stopped me from admitting the problem was there, even though I knew deep down. The fear of what other people would think, the fear of what would happen to me, the fear of what Suzanne, my wife, and my kids would think, and all that sort of stuff. So it wasn't until I managed to basically get the bottle to try and ignore the stigma, if you like, and just say, well, this is affecting my family, so I'm going to sort it out for us, never mind what anyone else thinks. And that was the point of when things started to turn around. The conversation was really good. Like, we had contract managers and stuff coming in and telling their own personal stories about how there was some awful stories, like how one guy's son had taken his own life, and things like that. And it's just like, to look at this guy, he was a welder, and then he became a manager, and then, like, he's a man's man in a male industry, and he's holding back the tears in front of a room full of 30 other men in a male industry. And it's just like, it's really good to see that barrier being broken down and the stigma being removed, because younger guys who are coming through and they're having their own families and they're seeing people that they look up to in the workplace being able to speak about these things it's invaluable.
Okay, well, that was Ross telling his story, and I guess that really is what this morning is all about. It's about guys like Ross. It's about stories that are very similar to his, and it's about Ross touches on a couple of things there that I think a couple of really key points there. We always talk about how men don't talk. Is that a myth? Well, as Ross kind of spoke about there, it probably is. Men do talk, and they will talk if they're given the space, if they're given the time, if they're given the right connections. Ross found that support at work and with his family. But what kind of support can guys like Ross get from services like ours that are here today? What kind of support could Ross have had early on? What kind of information would have helped him address the issue before it got to the point that it had done for him? And that's really what we want to think about today. And if you're interested in sharing that video, or it's obviously it's a great little film. It captures so much in a few minutes. It's on YouTube. We have a whole load of videos there, so you can access it and use it and so on, share it with colleagues. So I'm now going to pass you over to Michelle Guthrie, who is the chair of the Greater Glasgow Perinatal Mental Health Network, who's going to talk about why she thinks we're talking about Greater Glasgow and Clyde now, and the work that Michelle and her colleagues have been doing around perinatal and infant mental health and supporting paternal mental health. So over to you, Michelle.
Thanks, everyone. Can you hear me okay, Chris? Yeah.
I hear you, Michelle, yeah.
That's great, thanks very much. Yeah, so good morning, everyone. I'm delighted to be here, and thanks to Fathers Network Scotland for inviting me along today. I thought it was only fitting, given that it is a dad's event, that I give a bit of a shout out to my own dad here. So this is Charles. He'll be 84 next month. He's also fondly known as Chick, Chico, the Chickster, or Peas and Barley, as he was called in the army. So he'll be delighted to hear that I've given him a shout out today, and he's been part of the event in some way. So yeah, as Chris said there, my name's Michelle Guthrie. I'm part of the NHS Greater Glasgow and Clyde Mental Health Improvement Team, and part of my remit involves perinatal and infant mental health. I'm also chair of the Perinatal and Infant Mental Health Network. And just for the next few minutes, I just want to give you a bit of a flavour of the network, who we are, and how we've been working in partnership with Fathers Network Scotland to support paternal mental health. Cathy, if you just go on to the next slide, please. Okay, so the Perinatal and Infant Mental Health Network, it's a multidisciplinary network. It was established in response to the Delivering Effective Services Perinatal Mental Health Report. It wasn't until October 2018, when I joined the Mental Health Improvement Team, that I picked up chair of this network. So for me, really, my first year in post was very much about making those connections with colleagues and partners across our board area who were in contact or who work with new and expectant parents, and linking them into the network. And I have to say that time and investment has really paid off. And to date, we have over 150 colleagues and partners that are connected to the network. And that includes clinical colleagues from the mother and baby unit, from the infant mental health service. We have the specialist perinatal mental health midwives. We have health visitors. We also have staff from health improvement teams connected into the network. But most of our partners are from third sector organisations. There's actually too many to name, but many of them are here today. And that, of course, includes Fathers Network Scotland too. So the network, the role of the network, we play a key role in translating recommendations from the perinatal and infant mental health policy drivers into local meaningful actions. So for example, one of the recommendations from the Delivering Effective Services report focuses on training, and that's ensuring that staff that provide care and support during the perinatal period are equipped and have the confidence to sort of have conversations and manage perinatal mental health during that time. So we work in partnership with Fathers Network Scotland. to deliver the Understanding Paternal and Partner Mental Health training. And like everyone, it's been mentioned this morning, as a result of COVID, our network moved to an online platform. We meet monthly for 1 hour. We have a service spotlight section where organisations and network partners promote their services and their referral processes. And this really helps create that directory of supports and services that are available during the perinatal period. We also use the meetings to share good practice, any resources or learning opportunities that we come across too. And I have to say, this format, it's worked really, really well. It's a very simple concept, but it's been really effective, and certainly we'll be continuing with this format for the foreseeable future. Lastly, just in terms of the network, in terms of governance, we report back to our local implementation group that's been set up in Greater Glasgow and Clyde. And finally, just sort of moving on to our partnership with Fathers Network Scotland. Myself and Chris, we first connected, I think it was maybe early 2019, and we were involved, our board area was involved in the pilot in the How Are You Dad, the initial sort of training, which is now of course the Understanding Paternal and Partner Mental Health course. And our focus is very much working with Fathers Network Scotland to create a sustainable capacity building model to help support delivery of that training across Greater Glasgow and Clyde. And that's included a training for trainers model. We currently have 9 trainers in Greater Glasgow and Clyde. We did have a few more, but people have moved on. The trainers we do have come from health improvement, the mother and baby unit, primary care, mental health and third sector. And moving forward, we really hope that we can increase that cohort of trainers. We hope we can look at an instructor training that will allow us to deliver the T for T and become self-sufficient to build that capacity across our board area. And lastly, just to finish up, I actually just delivered an Understanding Paternal and Partner Mental Health training course last week. And I'll just leave you with a quote from one of the participants, which really just captures why this work is so important. And simply put, they said that we need to remember that both parents have a voice. So thanks for listening, and I look forward to taking some questions.
Thanks very much, Michelle. And yeah, that's a good wee reminder there. Please use Mentimeter to post your questions, and if you can't use Mentimeter, then you can use the chat function, and we'll keep an eye on that. I would also encourage you, Michelle spoke about the network that she chairs. It is a great sort of monthly opportunity to get together, to network, to share, to listen to what else is going on in the area. So if you haven't connected with that yet, then I would highly recommend it. And in fact, Michelle's being a bit modest there in terms of the model. It is a great model, such a great model that it's been adopted by the equivalent network Frew in Lothian. They have the same kind of hour monthly meetings with a spotlight session and chance to chat and so on. So it's a great thing to be a part of. So now I'm going to pass you over to our first panel. So if you're able to change the slide there, Cathy, if that's possible. So we are going to hear, first of all, from Nikki O'Hara, the manager at Glasgow Home Start North, and Thomas Lynch, the founder and service manager of Dad's Rock. And they're both going to talk about how they support dads in the Greater Glasgow and Clyde North area. So over to you, Nikki and Thomas.
I'm going to say, I'm not sure whether you can see me or hear me, can you?
Yep, both.
Oh, I can't. Yeah, sorry, I don't know whether it's the way my screen's set up. Thomas, shall I kick off? Is that okay?
Definitely, go for it, Nikki.
Excellent. Anyway, hi, great to see everybody here today. I certainly know quite a lot of faces. I am Nikki O'Hara, I'm the director of Home Start Glasgow North and North Lanarkshire. I think most of you probably do know the work of Home Start. Certainly Home Start Glasgow North and North Lanarkshire has been around for about 21 years. We provide practical and emotional support to families with children under the age of 5. There's lots of different services within our Home Start, but also within the Home Starts across Scotland and across the UK. I'm also a trustee on the board of Maternal Mental Health Scotland, which I am delighted to say has just recently, as you probably know, changed its name to Parent and Infant Mental Health Scotland to make it a more inclusive service. So I'm sure that will be welcomed by everybody. In terms of the work of Home Start, I think we would all Home Start employees would say that Home Starts are very inclusive. You know, we like to work across a wide spectrum of families where everybody's involved. But I have to say, having worked with dads for many years, I think we would really question about how inclusive we truly are. We started doing perinatal and infant mental health work around 8 years ago on the back of the bumps to bundles model. And I think at that point, we really did question about how inclusive we were of dads. You know, we would go out to families' homes, we would carry out assessments. I'm not sure how much we truly did ask, where is dad? How can dad get involved? So certainly over the last few years, we've really looked, we truly have looked at our paperwork about how inclusive we are, about how dads can be more involved. And we've developed services which include dad, but also services that are more specialist for dads. We've had a dad's worker for around the last 5 years. And again, I'm not sure how successful we have been about in truly including dads, because as much as it's about including dad in the best way that dad wants to be involved. So the groups have to be a little bit different, have to be tailored to what dads need, as opposed to bringing dads in as an afterthought. So these groups where we can have family groups where, you know, the mums engage on a more chit chat, cup of coffee, that's not how dads want to be included. What we've found is that dads would prefer to be involved, sometimes on a more practical basis. So we engage with dad, whether that's around doing gardening, doing stuff out in the community, but far less focused on initially talking about their family, but including them in a different way. We've tried different ways of doing it. We've even tried engaging male volunteers, but I'm sure some of you know, engaging with male volunteers is also pretty challenging. And it's really difficult to involve male volunteers into a service. We certainly try really hard, and we help what volunteers we do have, what male volunteers we do have, to engage with other volunteers. I guess we've learned over time that we need to think differently, and we need to think really hard about how we do involve dads. We've recently, actually 2 weeks ago, just employed a new worker called David, who hopefully you will all get to meet fairly soon. And we are embracing the Dad Matters UK model, which is very much about starting as early as possible, working with dads at the earliest opportunity. So engaging with dads at antenatal appointments. So that's a very new service, and certainly something that we look forward to showcasing across Glasgow, but also across Scotland. In terms of our relationship with Thomas, I'm going to let Thomas have a chat, and then we can talk together. I'll hand over to you, Thomas.
Thanks, Nikki. I would agree with what Nikki said. Our experiences are very similar. We've been working with dads for just over 10 years, and you know, I think there's been fantastic progress, and I think there's been lots of change, but there's lots of conversations that are still the same. There's lots of situations that are still the same. So it's clear there's lots of work still to do. We've been working in Glasgow for quite a number of years, doing a variety of different services. So at the moment, we have a young dad service, which covers Glasgow. So that's any vulnerable young dad under the age of 30, that's 1-to-1 service. And we've had some really good referrals and really good referral rates from that service. We do dad's antenatal face-to-face in Maryhill. And we've restarted our dad's Saturday morning sessions in the woods in Kilmarnock, and they've been really well attended as well. And we've also got our dad's WhatsApp group in Glasgow, which has been really good over the last couple of years. And our perinatal service, which Hugh made reference to earlier on, we have a national perinatal service to support new and expectant dads across Scotland. And about 30% of the referrals have come from Glasgow, which has been really good. And just taking Nikki's point about volunteers and dads volunteers, we were really pleasantly surprised that when we asked for peer support volunteers, we got volunteers, and most of them are dads that have come forward. And we've got about 14 dad volunteers who are supporting other dads across Scotland, which is a brilliant start, and that work is funded until next year. We've been talking to Adele from the neonatal unit in Glasgow, and we're hoping to do some work with them. And also the MB unit in Glasgow has been really, I would say, progressive and welcoming. And I think that's my experience of health professionals in Glasgow, is that the majority of them absolutely get it and are very proactive in looking at the whole family and thinking about the whole family. And I do think that Glasgow is definitely a bit of a trendsetter for other parts of Scotland, and it'd be great to see some of that work replicated. Yeah. And as for working together, we absolutely need to work together. I would say that, you know, there's absolutely lots of families who need support at different stages, and there's lots of capacity for charities, third sector organisations to do that. And, you know, I think it's clear that the last couple of years have been a challenge for so many. There's been some really good things that have come out the last couple of years, but there's been some real challenges, and I think that's going to take a long time to really sort of come to the forefront. So I think that lots of us are concerned about families and want to be there to support families. Is that what you were going to say, Nikki, or something similar?
No, I mean, I think that, you know, that I suppose the question that was posed to Thomas and I by Chris was, you know, what are the advantages and potential challenges of third sector collaboration? You know, and Thomas and I have spoken about that. I mean, of course, there are advantages and disadvantages. You know, the advantages are very much Glasgow is a massive place. You know, there is space for everyone, but what we certainly don't want is we don't want duplication, and we don't want there to be kind of seen as competition, you know, us versus them. We need to really collaborate and work together, and, you know, acknowledge that we have specialist areas and that there's opportunity for shared learning. I mean, Michelle's network has certainly created a space where there is certainly a shared vision, shared passion and training. I mean, I think certainly over the last, I say 5 years, you know, the training and focus available, I think many of us have done the sort of cross-reach perinatal training, and there's no point in reinventing the wheel when the training is there, whether it's, you know, how are you, Dad, or, you know, training from cross-reach. It's really beneficial we do it, but also it's about sharing good practice. You know, if Thomas is working in Glasgow, you know, we've got experience, a lot of experience of working with asylum seekers and refugees, and that's through our core work, which possibly, you know, Thomas, they don't have as much experience in that field. So it's about signposting and sharing, you know, what we've learned. I think in terms of challenges, I mean, this will come as no surprise to Hugh, but as much as we're all doing the same work, of course, there is competition when it comes to funding. And that can be really challenging. As much as you're trying to support each other in a third sector space, there is competition because there is a lack of funding, there's a lack of sustainability. It does put pressure on all of us as a third sector organisation. I'm glad Thomas is nodding there.
Yeah, I would agree with that. And I think, again, it's long-term funding, isn't it?
Yeah.
You know, if we're talking about actually making changes and supporting families, it's not the sort of thing that can be done in a year. There's so much evidence to show that. So therefore, I think it's long-term funding that is needed, and absolutely collaboration that is needed to avoid duplication, as Nikki said. But, you know, I think there's lots of I think there's lots of opportunities to support people, and I think there's lots of desire to support people in Glasgow and further afield.
Yeah.
Okay, well, thanks so much, Nikki and Thomas. Just a wee insight there into what your organisations have been doing and developed in North Glasgow and across the area. And I think those 2 points, collaboration and long-term funding, are both issues that we will keep coming back to this morning. So I'm now going to pass you over to Doug Marshall, the DADs coordinator at Glasgow Home Start South, and again to Michelle Guthrie, and they are going to talk about how the third sector and the NHS have been working closely together in the work that they've been doing. So I'll pass you over to Doug and Michelle.
Michelle, would you like to go ahead first, or feel free to?
Yeah, I'm thinking probably if you go first and just speak about some of the work, then I'll just come in terms of just what some of the advantages have been.
Okay, great. Cool. Right. So yeah, we're Home Start Glasgow South. I'm the DADs coordinator. You'll see joining me is also Joseph, who's our new part-time DADs coordinator. So we're glad to be expanding our service. A lot of our work is focused around obviously the early years. That's one of Home Start's hallmarks. And essentially we run 3 main areas of our work. So the one is an antenatal class, for a workshop for dads to be, that's been running for about 2.5 years now, maybe slightly more. And was in the New Victoria before the pandemic hit. And that was a really positive element, because it not only allowed men who were coming along to the regular antenatal workshops to learn, but they actually knew and they saw that there was a service available for them. And I think one of the key issues we talk about is currency. You know, what currency are we using? And I think for dads to be, there's a slightly different currency. And being able to approach them and say, right, you know, you're not the one giving birth. Obviously, we have the mother and baby units. There's been a lot of focus on mothers and babies, as is appropriate. But a lot of the times dads get moved to the category of parent, or, you know, someone additional. And part of our approach is to prepare men to take part in the unique viewpoint that they have in the process. And that's part of working towards providing better mental health and well-being for them. We run a course monthly, and yeah, when the pandemic hit, we moved it online, and you know, we're looking to be back in person. And I think that's probably one of the challenges we're looking at, and that's with third sector working with the NHS. You're typically working very small organizations, relatively speaking, to the NHS. So there's probably a little bit more fluidity in, or let's say speed in decision making. But at the same time, you're working with an organization that you can help integrate some of these services and guidelines into. And I think that's one of the great benefits of working with the NHS, is that, you know, you're helping to integrate something that is relatively small into a very big machine. And I think, you know, when I see Michelle's remit, and I think, you know, that's great, because this is where the 2 worlds meet, you know, translating from theory into practice. How do we actually do that? And I think this is a great opportunity. And as we've seen, and as Chris had said, the space has grown tremendously in the past few years. And in terms of what we can be doing, and I know we've discussed duplication and all that sort of thing, but there's a lot of opportunity for innovation. But we've reached a point where there's a lot going on, and there is acceptance, and there's a growing trend for dads to be more involved, and are, you know, wanting to be more involved, not just being dragged along, as it were. So that, I think, is one of the, you know, and so many of these things they're challenges, but they're opportunities. And so that's the way we tend to look at them. I think that's probably enough from me. Michelle, over to you.
Thanks, Doug. Yeah, and I suppose really just to echo all of what Doug had said there. I suppose certainly I've been on a journey in the last sort of 3.5 years, picking up the chair of the network. I suppose just in terms of some context, our mental health improvement team at NHS Greater Glasgow and Clyde, we are a very small team. It's myself, my colleague Laura, who's on today as well, and our health improvement lead, Heather Sloan. So we work across Greater Glasgow and Clyde. So I think someone had said, I think Thomas from DADx said, absolutely, we have to work in partnership, and this is where really third sector, comes into play for us, that, that we connect, we make those connections with our third sector organisations to make sure that we can sort of create that pathway of support for mums, dads and partners. And also as well that every family's needs are going to be different. So it's important that we've got that sort of a pathway of support that we can signpost families to supports that are appropriate to their needs as well. Also, our third sector organisations, they have that closeness to the people that I suppose the public sector, the NHS want to reach as well. They have probably more insight into the needs of the service users as well, and the communities that they're supporting, and those needs are what the public sector want to address as well. So they really give us that sort of snapshot of what's happening on the ground. And also our third sector organisations really can sort of bring innovation to this agenda as well, where maybe the public sector, like ourselves, may be a bit more restricted. So I have to say, and it's again just echoing what Nikki said there, the network, the Perinatal and Infant Mental Health Network is really, I think, created that space to break down barriers as well, I think, across third sector organisations. The Service Spotlight section is a really fantastic way of partners and organisations highlighting the work that they do and how that's maybe different from what other organisations do. So again, it sort of breaks down that apprehension of maybe, signposting, or maybe if you have a dad and family of thinking, well, maybe we can't really meet their needs, but, Dad's Rock is maybe best place for that as well. So it really sort of, creates that sort of cross-cutting working as well. And again, just in terms of some of those challenges, sustainability can be an issue at times. Certainly we've had some organisations that have had funding through the Perinatal and Infant Mental Health Fund, but that's only been for a year, and now that sort of service has, come to an end. So as much as there's been some fantastic sort of progress and developments, there's certainly still a way to go, I think, if we have to get it right for all new and expectant parents.
Great. Okay, thanks so much, Michelle and Doug. So now is the chance for the panel to answer any questions that people have. So Mentimeter is very clever, and it tells us which are the most popular questions. So there's one that's popped up here. Are school nurses being trained in the programme? I'm assuming that this is the Understanding Paternal Mental Health programme, although I'm not sure. As far as I'm aware, not yet. We've been focusing on staff working in the perinatal context. That's really down to capacity more than anything else. But this is a universal training programme that can be accessed by anybody working within a sort of children, young people and families context. So they would absolutely be welcome and able to participate in this training if we're able to kind of expand it further. So someone else has asked, does the Scotland national football squad have won any equivalent sportsman to Marcus Rashford et al? Well, you know what? I'm not going to answer that question. I'll pass that over to the panel. I don't know if anybody that's been speaking there has the answer to that question. Any thoughts, Thomas or Doug or Nikki or Michelle on that? You're on mute, Michelle.
Oh, can you hear me now?
Mm-hmm.
Yeah, no, I don't know. I'm just saying I've got a friend that actually works for the SFA. But I'm not sure about an equivalent sort of spokesman to Marcus. Not sure if anyone's put themselves forward for that.
Yeah, I'm not aware of any, but I think the fact that there's been more and more exposure to men's mental health, and the stigma is slowly but surely sliding away. I speak to a number of men who they've just got to a point they realize we can talk about this, and this is not shameful, this is not impacting my masculinity. We can talk about it, and I think that comes from a national and a broad perspective. But in terms of someone local, no, I'm not sure.
Well,
I was going to say, sorry, Chris, we've just recently engaged, and in fact they've come to us, which is always welcomed, with Partick Thistle. That might not be everybody's team, but it's a start. But they've come to us to talk about the services being offered, and obviously it is about everyone, but their focus is about engaging with males and dads. And we do know that the population in football grounds is more male dominated. So we're really keen to certainly take that forward, and promote our work, the work of Home Start, but also about the important work of engaging and supporting men's mental health.
Yeah, absolutely. And I think the question probably does touch on that issue that I guess in Scotland, football is obviously it's our most popular sport. It's not the one that we're best at, but it's our most popular sport, and that's for sure. And as you've said there, Nikki, it's traditionally a very masculine, testosterone-fueled environment, which I suppose talks to the thought that men don't talk. But there's a lot of work going on in and around those spaces. And changing rooms, for example, is a great example of a project that's been going on for a number of years now, encouraging fans and footballers alike to talk and engage in conversations around mental health. And we're seeing that expand into other services that are available now, such as Andy's Man's Club. Lots of spaces emerging around Scotland for men to come together and to talk and to share and to support each other, I guess. So we are a little bit behind schedule, but just before we finish off for a break, I just have one quick question for the panel, and this is really from a third sector perspective. Obviously, you've spoken about what's working in the third sector, what's been happening, maybe touched on some of the challenges, but from a third sector point of view, what can colleagues in health do? Thomas, Doug, and Nikki, I'm really asking you, what can colleagues in health do to really continue to support and open the doors to the kind of work that you've been able to do? What needs to happen? What's been working? What can we build on?
I would say from my experience, I think the people who are engaged and the people who get it need to continue to shout about it. And I know that might sound like it's putting a lot of onus on you, but it's true. I think that lots of organisations around this call and this area have been doing this work for quite some time, and there's been amazing progress, but still lots of families are telling us the same stories that we heard 10 years ago. So I think we just need to continue to shout about it. We need to continue to talk about things being inclusive, and inclusivity is a really big focus. And I think we're always going to be playing catch up with that, because society moves so quickly. Just as we think about using the word parent, there's families in Scotland who stop using the word parent. So we need to continue to try and catch up to make sure that we are open and supporting as many people as possible. So I think it's constantly moving, isn't it? And to me, that's kind of exciting that it's not staying still. So I think continue to shout about it.
I think if I could just add to that quickly, and along the lines of Thomas's comment about just being the parent, dads are often just the parent, mum, baby, and parent. I think if it's inclusivity from the top down, but also front line, and I think that's what's important. Dads, nobody wants to feel like an add-on or an addenda to a process, and I think it's including them from the get-go, from the person who sees them first when they arrive for their appointments, right up until baby's born and thereafter. So I think that's one of the key elements, and there's actually a few key little things you can do to start facilitating that. So it needs to be top down, but also bottom up.
I was just going to add, we've obviously all got relationships with strategy, with NHS, etc., but I think it's also about enabling our NHS colleagues to have the opportunity to understand and learn more about what third sector has to offer. And we know there's massive pressures on the NHS, and it's getting the space to enable them to, whether it's cross-refer to us, but also understanding and knowing what it is we have to offer. You know, I commented on the box there that obviously Michelle's space is a great opportunity for us to learn from others, but are our NHS colleagues getting the opportunity and the time to actually understand what there is out there, which would actually help their jobs and certainly improve outcomes for dads across Scotland and across the UK.
Chris, if I could just come in there as well, and I think as Thomas mentioned there, that there's lots of champions, you know, for this agenda, and certainly we have made sort of lots of progress. There are sort of really good pockets of work, and I suppose it's really how do we upscale that in a sense as well. And you know, there's some sort of early work we're doing with the mother and baby unit, like conversation workshops, where it's an opportunity for third sector staff to come along, you know, to find out about the mother and baby unit. And again, just to sort of increase that awareness and knowledge of, you know, what the mother and baby does, you know, what's the referral process. But again, that two-way of finding out, you know, this is what third sector do as well. This is how we can sort of support that journey from conception, you know, right through to that sort of 2 years or up to 1 year. But still, yeah, that's just a small part of some of the work that's going on.
Okay, great. And I see you've got your hand up, Hugh.
Yeah, I'm slightly off the tangent, Chris, but I think honestly there's also a real need to really look back hard at what happened during COVID and the lockdown, and how we viewed fathers and families in that period. I think there's some real learning to be had there about how we look at the whole family and involve fathers, and it probably showed some of the fault lines, as COVID did, around a lot of things, I think.
Yeah, thanks, Hugh. Okay, well, thanks for all these points. We are 5 minutes behind time, 5.5 minutes behind time. So we're going to go into a break there, but I guess just to kind of summarise what people were saying there, in terms of where we go from here, from sort of third sector and NHS collaborative perspective, it really is about keeping those conversations going. It's about the people who are championing this work continuing to do so, but also to try to get to a place where the work isn't just happening in pockets, as Michelle mentioned, it's actually universal across services. And Sarah from Home Start Scotland's made a great little point there, embedding these cross-sector relationships in the pathways of care seems like a sort of sensible next step. So it's not just about conversations and networking and so on, it's about actually bringing it into our systems and our processes in a more formal way, to kind of embed those conversations in the work that we're doing to support the thousands of staff that are on the front line to understand and feel more confident in relation to talking about the issue. And as Hugh said there, we learned a lot. It's shone a spotlight on fathers and the wider family members during COVID in terms of what was missing and maybe what we haven't been getting quite right. And we really need to learn a lot from that. And we're going to share our video with you and a wee bit about what Dad's told us about their experiences during COVID. So now we're going to have a little break. If we could come back at 20 past, that gives you 8 minutes to grab more of you will be drinking coffee than tea, so the poll said. So if you want to go and make yourself a coffee and tea, and we'll come back in just short of 10 minutes time. Thank you. We are now going to hear from our colleagues from the NHS, who are going to talk about some of the fantastic work that's been happening in our frontline NHS services in the Greater Glasgow area. As before, I'd encourage you to post any questions you have for these people, either on the chat function or using Mentimeter. So without any further ado, we're going to first of all hear from Stephanie Mair, a specialist perinatal from the Specialist Perinatal Mental Health Midwives team, and Jane Turner, who's a consultant child and adolescent psychotherapist from the relatively new infant mental health team. And they're going to talk about the importance of dads as part of a whole family approach. Actually, it's not going to be Stephanie and Jane, it's going to be Adele and Karen. I do apologise, I've got my slides the wrong way around. Is that right, Cathy? Okay, so Adele Frew, the senior nurse from the Queen Elizabeth Neonatal Unit, and Karen Drummond, nurse therapist from the West of Scotland Mother and Baby Unit, talking about how they've been developing pathways of support from dads. So over to you, Adele and Karen.
Hi, my name's Adele Frew. I'm a senior staff nurse in the neonatal unit, as Chris had just said, in the Queen Elizabeth. So I was just really wanting to talk about kind of how we started. So a few years ago, after some conversations with dads, I had decided that there was a gap to help dads encourage to think about dads. How are you, Dad? And I got in touch with Chris, and really from there we've really came a far way. So dads are encouraged, as soon as the baby's admitted, dads are encouraged to participate in wards rounds, encouraged with their baby's care. Staff encourage them to do skin to skin cuddles, and we know the more dads are supported, it encourages bonding, attachment, reduces stress, increases their confidence, and it makes them feel more involved in their baby's care. We also, in the unit, we are a family integrated care unit, so for short it's FECare. And through that we have a hug group, it's called Helping Us Grow. And before COVID there was lots of family sessions, parent sessions. Some of them were informal sessions, some of them were quite fun. And there was a knit and natter session, and that was actually a huge hit with dads. They used to get really worried about who was dropping my stitch, believe it or not. We also had a pizza night with dads, and we invited graduated dads that have been in neonatal before to come back and talk for some peer support. But again, that was all pre-COVID, and also obviously through COVID it's been quite difficult. It's been quite strict within the ward, as you can understand. It's an neonatal intensive care unit, so we have to prioritise the patients as well. But obviously we're coming out the other end of it, and we're hoping to get back to the parent sessions, meeting dad, having a dad's group again and everything. So I'll just talk about, just recently we've put out a survey. So this was just recently, and there was lots of questions on it, but these were the kind of main ones, important ones. Do you think there is enough support for fathers in the neonatal unit? So it was a really good response, with 73% saying yes and 20% saying no, but we thought that was quite good. The next one was, how do you feel fathers can be better supported? So again, a bit variable. We got good answers, but then there is one, like, to be listened to and to be talked to, not blanked while talking to mother. Maybe more one-on-one, but then there is some good feedback. My support was spot on. The next one, so would you find peer support from graduate dads useful that have been in the neonatal unit before? So 66% said 60% said yes, 33% said maybe. And the best way to deliver peer support, 66 said face-to-face, and then it was 53 for social media and 53 for WhatsApp. So we're now focusing on kind of going forward post-COVID, because obviously that's changed a lot. So we're continually looking at ways in which we can best support fathers in the neonatal unit. And we've been lucky enough that Chris did a training session, How Are You, Dad?, with staff. And I'm now a trainer as well. So I aim to train all staff, especially new neonatal nurses that come into the unit, to encourage involving dads. And we've also recently been speaking with Thomas from Dad's Rock, and we're hoping to work with him, and committed to building a good support system for the dads within the neonatal unit, and also once their baby's discharged as well, to make sure they're supported the best way. Sorry, that's me.
Thanks, Adele. That's great. So I think we're now going to hear from Karen Drummond.
Hi there. I've just noticed there's a cherry picker doing work outside my flat, so I apologise if there's any kind of background noise. So my name is Drummond. I'm the nurse therapist in the West of Scotland Mother and Baby unit, and that's in Glasgow. So we're a regional unit. We take admissions from all the West of Scotland, and we also work really closely with our community perinatal team who cover Greater Glasgow and Clyde. So it's a 6-bedded unit for mums and babies, and we admit ladies either in the late stage of pregnancy or up to 1 year postnatal, who are experiencing acute mental health problems in the perinatal period. So we've been really lucky in the last year or so to get extra funding from the Scottish Government. So we've got lots of new sort of roles within the service. So the team is made up of nurses, mental health nurses, psychologists, psychiatrists, occupational therapists, and we offer support and treatment to mums with the aim of helping them recover from whatever mental illness they are experiencing, while very much promoting their bond and attachment with their baby, and very much keeping mum and baby together. And I guess even from this exploration of the service, it made us really notice actually the focus is on the mum and the baby, and not so much focus on the dad or the partner. So before COVID, the dads and partners and families could come on board and spend really as much time with mum and baby as they wanted. And that was such a good opportunity for us to get to know them and them to get to know the staff. But suddenly when COVID hit, that was completely taken away from them. So initially there was no visits allowed in the ward at all. So dads were really, really separate from the mum and the baby. And when the restrictions started to lift, it was just 1 hour a day. So that was the only chance they got to spend any time at all with their new baby and their partner. And staff were really, really mindful not to interrupt this time. So it really seemed the dads were not being included as much as they could be. So it got us kind of thinking how we could be more inclusive. So initially we made kind of small changes, like just putting posters around the ward, just including dads and partners, having kind of written information and leaflets and things about signposting to services that are out there to offer support to dads and partners, and also kind of educating staff on the impact it can have on the partner as well. But we kind of realised that wasn't really enough. So myself and 2 of my colleagues started to develop a partners pathway, and that was really to make sure that the support offered to dads was consistent and structured and it wasn't being missed. So we really did this by taking the lead from the dads themselves, so just simply asking what do they need, getting feedback from them, involving them in it, also asking mums what they think the partners need, and also kind of linking in with other organisations like Fathers Network Scotland and Dads Rock, people with lived experience. So just to kind of speak through the pathway a bit, obviously it depends on consent from mum, but we do aim to offer kind of contact with the dads within 48 hours of mum being admitted to the ward, and that's initially just to kind of orientate them to the ward, an opportunity to discuss mum's mental health and the kind of treatment plan and involve them in it as well, and then just kind of checking in with them, so how are they doing, what do they need support with. Some of them say no, they don't want kind of further support from themselves, and that's okay. But then we make sure we just kind of give written information and emails and leaflets about signposting resources and what they can do or how they approach services if they do want support from themselves. If they say yes to ongoing input, which most of them actually do, we can offer weekly input with them, and more if required. And there's kind of 3 different strands to it. So the first kind of aspect is focusing on mum's recovery, her treatment, the kind of progress with this and discharge planning, inviting them to any meetings or ward rounds that we have. Second aspect is discussing dad's mental health. So how are they coping, what do they need, and the kind of third aspect is exploring their relationship with their baby as well. So that dads actually engage really, really well with it and take up the offer of weekly support. And I guess we've noticed a big kind of impact on dads, more so when ladies are discharged from the ward. Mums and babies have all the support for 24 hours a day in the hostel for weeks on end, and then they suddenly go home and it kind of hits dads then, so we offer kind of follow-up on discharge as well for them. I guess some of the challenges are dads tend to put mums and babies first. The focus is on mum and baby, and even the name of our unit, so it's a mother and baby unit, so it's maybe not the most inclusive. So to kind of overcome this, we've just really involved them from the start, made them feel really welcome, kind of educated them on the service, what we can offer, and kind of normalise and validate their experience and definitely take the lead from them. A big barrier, I guess the restrictions have been really, really difficult, but that is kind of starting to ease now. But the biggest barrier we have just now is actually the systems that we work with. So to put it bluntly, Dad isn't the patient. So there's nowhere to really document the input that we can give them. And in the NHS, if it isn't written down, it doesn't happen. So it's a huge barrier just now, so it kind of limits what we can offer. And ideally, we'd want to offer screening tools for dads in terms of their mental health, offer kind of low intensity psychological interventions for the dads as well, and also offer more kind of intense work for them and the baby if they want it, like input with the nurses or with their kind of infant therapists. But just now, I guess it's just difficult because the systems maybe don't allow us to do that. So we've identified what dads want, we've identified what they need, and we've identified the impact it has on the whole family. But unfortunately, the systems are just not letting us to kind of move forward with it as much as we want just now, which is really frustrating.
Great, thanks Karen, and thanks Adele. That's fantastic to hear about the work that you've been progressing in your wards. So we're now going to hear from Stephanie Mair and Jane Turner. So I'll hand over to you two.
Thanks, Chris. Hi everyone. Thank you for the lovely introduction and to Chris for asking me to be part of today. For those who don't know me, I'm Stephanie Mair and I'm one of 3 specialist perinatal mental health midwives working in GG&C. I'm based in the RAH, but also cover the Vale of Leven and Inverclyde hospitals. My colleague Lisa Allen is based in Queen Elizabeth in the south, and Lynn Komalafe is in the Princess Royal in the north. Our roles are still relatively new to GGC, having only been in these posts since March of last year, and we were the first specialist midwives to work within maternity and neonatal psychological interventions, or MNPI, which is easier to say, service. So it's been a busy year establishing that role and completing our own specialist training. So we know that fathers being well prepared, informed and involved throughout the maternity journey has a positive impact on themselves as individuals, but also the mother's health and well-being, the baby and the family as a whole. And we want fathers to feel like they are confident co-parents, and by involving them from the beginning, that very first booking appointment, we hope to achieve that by increasing their trust in the maternity professionals and by reducing their own anxiety and fears through knowledge, skills and support. From a maternity service perspective, thinking about fathers over the past few years of the pandemic, as we've mentioned already, they've been physically excluded from much of the antenatal and postnatal care, and for some, even the birth of their babies if they've been unwell. I remember as a community midwife, as I was through the first year of the pandemic, where we were all navigating through this big unknown, trying to keep dads as involved as possible, offering mum to FaceTime during appointments or recording the baby's heartbeat for him to hear later, to give him that important aspect of bonding and attachment to the baby. And we were all just doing our best with what knowledge we had at the time. So whilst the key focus for maternity at the moment is service recovery, including welcoming fathers back to these parts of the journey, the pandemic has also served as an opportunity to reset and consider what should revert back to pre-pandemic states and where we can improve. For example, the relaunching of antenatal education classes, but in a more hybrid approach, both face-to-face and on online platforms for those who are able and wish to attend either way, which should also give fathers greater flexibility to be involved. In GG&C, we're continuing to work towards a best start model of continuity of care, which is so important, as Hugh mentioned earlier, where families will have a named midwife who provides the majority of their antenatal and postnatal care. And we know that this model has benefits to the mental health of the mother, but this real relationship-based, family-centred care doesn't have to stop with mum. And that's why it's really important for me in the staff training aspect of our role that we've got a maternity workforce who are skilled in encouraging involvement of dads in the journey, but also screening and signposting or referring of fathers to additional support where required. And the findings mentioned earlier from the 2018 survey Chris mentioned show quite sad statistics, which demonstrate how important that staff training is when supporting fathers, and how invaluable collaboration with our third sector colleagues can be at this time. Now, more specifically, part of our work within the MNPI team involves supporting families who've experienced birth trauma, and that's something that I'm personally really passionate about. And we're fortunate to be able to provide a space to listen to stories of mums and dads about the events of their labour and birth which have had an impact on their mental health. And it's important for the specialist midwives to encourage fathers to join these sessions too, to provide that healing space after a traumatic experience. And yes, the events have physically happened to mum, but as I quite often say to parents, that dad's been a witness to who is the most precious person in their life at that point, bringing their new most precious person into the world, where they might have felt anxious, scared, and more often than not completely helpless in a situation. And it's important that we can acknowledge that and validate their experience. And often debriefing and clarifying understanding of what has happened in those events can be enough, but within MNPI, having that multidisciplinary team approach that we do, where the clinical psychologists can also offer more specialist support as well, is invaluable. And really, these appointments actually complete the cycle for us, so we can offer these experiences and services to families, but we can take that feedback from them to shape not only future pregnancy planning for the parents as individuals, but service improvement as a whole for the population of service users, so that they can feel safe and empowered to return to expand their family if they wish. And now I could talk for hours on this, but that gives a very brief summary of where we're at in GGC from a maternity perspective. And I look forward to answering any questions later if I can. And I'll hand over to Jane at this point.
Thanks, Steph. Hi, everybody. I'm Jane Turner. I'm the lead for the Infant Mental Health Service in Glasgow and Clyde. And we're a brand new service. We came together as a team in the autumn term of 2021. Cathy, I can't actually see my presentation, but thank you if you could share that, that'd be helpful. So yeah, we're a brand new team, and I guess we were fortunate to receive funding, which was mentioned by Hugh earlier. If you can move on to the next slide, please, Cathy. We're a multidisciplinary team and we cover the whole health board. So we include a wide range of professionals, and we're able to offer a wide range of interventions. And as everyone's been talking, I was thinking about what feels so important when we're thinking about dads is to hold on to that curiosity about a dad's experience. And also when I was looking at those questions that I've seen before and the percentages, which, despite the fact of seeing them before, always sort of shocks me, the idea that only 16% of dads are asked about their mental health. But I guess the question that I'd also want to be included is any, and the question for me is, are dads asked about their relationship with their baby? So if we could move on to the next slide, please, Kath. So what is infant mental health? I mean, I'm probably speaking to people who know about this anyway, but just as a reminder that actually there is no infant mental health without the context of healthy relationships. So our social, emotional and cognitive well-being and development all has its roots in a responsive, warm, good enough relationship with primary caregivers, and usually it's a mum and dad. And this helps an infant to develop the capacity to form close relationships, to develop the capacity to experience and regulate and express emotions, and also to develop the capacity to explore and learn. So next slide, please, Kath. And as we look at these quotes, I guess it's a reminder that babies are born with an innate capacity to want to relate and to communicate. And as Donald Winnicott said, there is no such thing as a baby. Babies don't exist. As much as we're called Infant Mental Health Service, babies are totally dependent on the adults around them. And if you start to describe a baby, you're describing a baby and someone who provides the care. So if we could move on to the next slide. And Sebastian Kramer, I really like this quote. He says, in the baby, in the child's mind, and as the child is developing, there is no child that's without a father. And so in the absence of any given story, he will make the story for himself. So next slide, please. I think this has been touched on today, but I guess what we're wanting to make sure is that we're providing a space inclusive for fathers. So who can fathers talk to if they're struggling with their relationship with their baby? For example, if they're finding the cries of their baby too much to bear, or if they're having thoughts about their, difficult, disturbing thoughts about their experience with their baby. And how does pregnancy, birth and having a baby impact on dads? And we heard a little bit from Ross earlier, didn't we? And again, I was thinking, who asked Ross about how he was feeling about his relationship? And a father's mental state, like a mother's, can change at different stages in a baby's life. So I'm being told I've not got much time left, I think. So if we could move on a few slides and I can talk about, could we move on a bit further? That's great. So we're going to be offering, and we are offering, we open to referrals from November, and we're offering direct clinical work, consultation, education, raising awareness, and we're very keen to work with third sector partners, which we've started to do. But how we aim to include fathers within our service delivery is to be curious right from the start as we get to know the family, and to include fathers within our assessments, within care planning and formulation. And we ask fathers to complete screening measures and tools that help us understand about the father's experience, about their own mental health and their relationship with their baby. We want to include fathers within participation, and have done, for example, when we were sort of thinking about a possible different name. And as you see, we're now called We Minds Matter. And we're also including dads within our evaluation. And it's very important for us to join up, as has been said, with the third sector and in the network to ensure that fathers have support, access to our service. So if we could move on to the next slide. This is telling you about when to refer to us. So I'm not going to go too much into that, but just to acknowledge, I guess, that our aim is to normalise the inclusion of fathers. And when we go out to meet families, we very much encourage and invite the father to be part of the work. And I would like to again say lots more, but I think I've run out of time. But look forward to questions later.
Okay, thanks, Jane and Karen. That was fantastic to hear about. Sorry, Jane and Stephanie, that was fantastic to hear about your thoughts and what you've been doing around trying to involve fathers more. So that was our second panel this morning, Stephanie, Jane, Adele and Karen. And I wondered if there are any Mentimeter questions that have been put forward, Cathy. But before we go to the questions, just to touch on that question you asked, Jane, about how many dads were asked about their relationship with their infant. The survey actually that we were referring to, where only 16% of dads were asked about their mental health, also did ask that question: how many dads were asked to consider their role as dads, the one thing that they have more agency over than anything, I suppose, during that period. And less than half of dads who took part in the survey were asked to think about, it was 40-something% were asked to think about the role as a dad. So again, it's another big miss. We're not asking a lot of these dads even to think about that very simple thing. How are you thinking about your role as a father, and how are you thinking about your relationship with your child? We're not encouraging enough dads to even take part in that initial conversation. So questions. So we have one question here, which is: can we have specialists, health visitors in Greater Glasgow too? Investment in specialist midwives is great, but why not recognise wider universal service? Well, I'm not the person to answer that question. I'm not sure if anyone on the panel is, or it may actually be Hugh that's the best place to answer that question. So I'm going to put that out to all five of you, see what you think.
I was looking to Hugh as well.
Okay.
Sorry, couldn't get my mute button off there. Yeah, I mean, obviously, you know, I think, I mean, Mary Bellman's on the call today, Mary, and I think you'll probably be somebody who'll be very much advocating that this should happen. And I think the evidence today is that they can make a huge impact, and both in terms of that direct care, but also in being able to work with the staff around understanding and rolling out. And as I said, we've got that training program in place, and I know that a good number of GGC staff have completed it. So it's probably something to continue that discussion on. I don't know if, I'm not putting you on the spot, Mary, but I did see your name pop up somewhere. So you're very much the expert on this.
Oh, thank you, Hugh. I absolutely loved when I saw the question there, because as you rightly say, I would absolutely advocate for that as well. I think health visitors play a really vital role within that perinatal period, and often are dealing with very complex situations in their day-to-day work. So I would absolutely agree that having specialist health visitors working alongside their colleagues, their midwifery colleagues, would be a really worthwhile investment. And there is certainly evidence there to support the worthiness of that. In NHS Grampian, they've got a specialist health visitor now. Shetland had one, but she's recently retired. So there are areas in Scotland who are looking into that model if it's something that you'd be interested in. Thank you.
Okay, thanks. Just going to jump onto the chat function here. Lizzie Hannaford had a question. I'd love to know how you're doing things with where or how partner support is recorded. So I suppose in terms of the process, is there a process from the panel's point of view, people that were talking about your own service, how do you record that information about a partner's support, or who he or she might be? Anyone from the panel want to share your experience with that and what you do?
I guess for us, that's the biggest barrier for us just now. So we only have access to mum's notes. So any kind of interaction has to be recorded in mum's notes, but again, mum is the patient, not dad or partner. So we're able to put some information in terms of kind of initial conversations, aspects of concern and things like that, but we're not able to document anything like screening tools or any more kind of targeted, like almost prescribed kind of interventions with them. So we can't actually do it just now. So that's a big barrier. I know there's lots of other services like that as well, so we're having conversations with them and kind of taking it to like our business meeting and things like that, and how we can maybe, and it's not, we won't be able to look at that system, but how we can maybe start to think about where can we record that and how could we maybe change that, because that's stopping us moving forward with giving dads and partners more support. So we're not able to do it just now.
I agree with Karen totally, and it's one of my biggest bugbears in terms of being involved in setting up a service, in that our systems are not relational. You know, if you imagine that working with an infant, for example, or working with a pregnant mum, it's so complicated in trying to set up the system. And if we're wanting to evaluate, for example, the work that we do, we have to sort of have all these separate bits to ensure that we're including the work that we're doing. So we do obviously include within the clinical notes that we're doing the work, but it's so difficult to be able to link. And this isn't unusual, it's always been the case. You know, when I worked in CAMS, it was, you know, a similar challenge, but I think it's a shame that we can't be more forward looking and think about how do we develop systems that are more relational themselves, rather than, you know, treating us all as individual units, which we are not. And, you know, we're all interconnected within our relationships.
Yep, and I work with Lizzie, so I absolutely echo her comments. But actually just sharing this conversation itself, it shows that we're all having the same difficulty from different services. So strength in numbers and hopefully a bit more collaborative thinking, we can come to a solution.
Absolutely. I think it's a universal issue, and it's one that we come across every time we work with staff, not just in perinatal services, but even something other universal services such as schools and nurseries, for example. The way that we record information, as you've touched on there, Jane, it directs us in terms of who we're thinking about, who we're connecting with, but also how we evaluate what we do. And I don't think any of us think that any service intentionally excludes individuals, excludes partners, excludes dads. But by not systematically recording that information. We are guilty of passively excluding that wider family, and we're not responding essentially to the demands of Guthrie, to the demands of the promise, all these things that are telling us that we should be working with whole families. Our systems aren't working for us. So that's probably a takeaway from today. What can we do in Greater Glasgow? We're already sort of, you're already sort of trailblazing the work around including fathers and thinking about dad's mental health in Greater Glasgow. But in terms of our systems, what can we do? What steps can we take to make our systems work for us and not the other way around? So I'm just a little bit aware of time here. We're supposed to have a quick break, but I just wondered if there was any other pertinent questions that anybody had to ask. So somebody's asking, are there any plans to provide health visitors with details of all the third sector organisations that are involved with DADs? Just not everyone is aware of them, which means service is unequitable. Well, those details, and to an extent, can be found in 2 places at the moment. Inspiring Scotland have a directory and are always encouraging third sector services to pass their information on to Inspiring Scotland. So if you have a look at their directory, you'll be able to find some information about some of the services that are out there. And Fathers Network Scotland, we have a directory as well, which tells you what's in your local area in relation to not just dad's work, but children and families work as well. So I guess these are 2 places, and Inspiring Scotland and Fathers Network Scotland, we're really dependent on organisations telling us and sharing their information with us. One last question then. So are there plans to widen work to partners more generally so that same-sex parents are included? That's for the panel, I guess. Is there anything that anybody in the panel would like to say in relation to that question?
Yes, I'm just wondering if maybe I can come in and just sort of highlight some of the work that we have been doing through the network. We certainly recognise that all sort of family makeups are different. So last year we did commission some LGBT plus perinatal mental health training. We put that out to the network, but we had some of our clinical colleagues as well. I think it's certainly a gap from a national perspective in terms of some of the learning opportunities that are put forward or are available to staff. I'll also put in the chat function. So certainly we always try and take that equalities approach through the work that we do. So again, another piece of work that the network have taken forward is almost like a good practice sort of toolkit for staff. And it's sort of structured around the protected characteristics of the Equality Act. And we include obviously information about same-sex relationships there as well. That's actually due to be updated, and we're going to be doing that more collaboratively with the Infant Mental Health Service. But again, it's just not an exhaustive sort of resource, but it gives a bit of a flavour of, you know, here's what you could be doing in terms of being inclusive as well. So I'll put that link in the chat for anyone that wants to have a look at the toolkit.
Great, thanks, Michelle. And Jane, you've got your hand up.
Yeah, I was just going to say in We Minds Matter, the Infant Mental Health Service, I guess we work very systemically, and what we're thinking about is who is it around the baby that's emotionally invested in the care of the baby. So, you know, that might be a biological father, a co-parent, a same-sex partner, granddad, grandma, or aunts, uncles. So we're interested on, you know, who does this baby depend on for emotional and physical care.
Absolutely, Jane.
So they would be included within the work.
Sorry, Jane. Yeah, thanks for that. And I think that's something that we do try to emphasise as well very strongly, is that I guess we're talking about dads and partners, but really when we're working with services to help services thinking about how we include the wider family, we are talking about the wider family. Who is that family? What is the makeup of the family? Who are the key other parenting figures? And it may be a grandparent, it may be a child that comes along with 2 mums or 2 dads or whatever. It's about that wider family unit, really. That's what we're talking about today. And just one quick comment from Adele. You've got your hand up?
Yeah, I was just going to say, we see it more and more within the neonatal unit, same-sex parents and different just situations as well. And I feel we don't treat them differently. And we've also got a great team of psychologists and they're on hand within the unit to help. And we're really good, I feel, at promoting services that are there.
Brilliant, thanks Adele. And Hugh, you put your hand up as well.
Just very quickly, Chris, I know you pushed for time. Just to acknowledge Amy's question there about suicide in young men and dads, and I think it's certainly an area that I would be very keen that when we look at the evidence in more detail, that we really focus on that, because I think there is a story to tell there as well.
Absolutely, absolutely, Hugh. So we are a little bit behind schedule. We're due to finish at 12:30. So can I suggest that we have a quick break, maybe 5 minutes? So if we come back at around about, I guess, 3 minutes past 12, just to be precise about it, and then we shall finish off the rest of the morning. Okay, so we'll see you in 5 minutes time. Thank you. So without any further ado, I'm now going to hand over to Cathy, who is going to talk a little bit about, well, Cathy, I'll let you explain that. So on you go.
I'll try and keep this very, very brief, actually. I think probably the film does most of the legwork for me. Hopefully you managed to see that during the break. But just to kind of reiterate what Chris has said, we've been undertaking dad surveys since about 2017. So it was the year after Year of the Dad. And in 2018, right at the start of this event, we talked about a dad survey with perinatal services that influenced all this work that we've been doing. But in the last probably 3 years or 4 years, we've been going out to dads across Scotland and asking them pretty standard questions. And we've actually got a researcher who's with us today, Jessica, who did a sterling job last year of helping us out with our research. And she is again helping us with this year's dad survey. So I'm really going to do a really light touch on some of the changes that we can see in terms of dad's mental health. So this isn't specifically about dads in the perinatal period. This is about all of the dads across Scotland that we've been asking, but hopefully you'll get a sense of the trends in mental health. So I'll just share the screen. Oops. And hopefully be able to move forward if I can. Oops. Let's see whether I can do anything. Okay, here we go. So this is from our last survey, which went out in November last year. So this is 2021. And this is showing changes through time. So the sort of bluey green color was during the first lockdown. The orangey color was during the second lockdown. And the red color was in November of last year. So as you can see, how people feel about how optimistic they're feeling has kind of stayed reasonably similar over the 3 lockdown periods, but obviously people are very worried. It looks like people are getting worried and very worried in the last survey. But this is probably more interesting. Oops. This next slide. So this is rating dad's mental health. So again, the sort of bluey green was the first lockdown, orange was the second lockdown, and the red was after the lockdown period. So this is in November last year. So you can see a gradual increase in dads rating their mental health as bad or very bad. So you can see 17% bad during the first lockdown. That's increasing to 29% in November last year. And again, you can see the same trend in very bad as well. So there's this obvious increase in dads really struggling with their mental health as the pandemic's progressed. And probably it will be a little surprise, but the people who are from quintile 1 of the SIMD are struggling the most. So 80% or 87% of that segment of the dad survey said that their mental health had deteriorated in the last 6 months. That compared to quintile 4 and quintile 5, which is 59% and 64%, as you can see. So it's not painting a particularly rosy picture of what's happening with dads. And this is another interesting slide and perhaps pertinent to all of you today. So this is about how dads reach out, how they look for support when they're not feeling okay. And as you'll see, most dads will reach out to their partners. And over time, this is quite interesting, but over time, you'll see that to begin with, during the first lockdown, it was 63%. That was then increased to 67% during the second lockdown. But we've seen this really big drop off in the last survey of dads not feeling that they want to share with their partner how they feel. And that's of serious concern to us, I think. And it correlates as well with other findings within the survey, which showed that dads' relationships were deteriorating with their partners, which is really, really concerning. But what you'll see, and I don't know whether this is just chance or whether it's a trend, is that the number of dads looking for support online or through a helpline has jumped in this last survey. So it's gone from 9% up to 20%, which is really, really significant. So dads potentially who are not sharing how they feel with their partner are looking online for support. So in terms of dads reaching out to look for support from peers or from the third sector or whoever, that's a place where they will look, it seems, is that they're looking for support online. So how do we capture that group? So as I said, I really wanted to keep it extremely short and sweet. Hopefully you'll know that we're currently doing this year's dad survey at the moment. We've been really blown away by the response from all of our supporters, actually. And I'm sure there's a lot of you who have shared on social media our posts looking for dads to share how they feel, share what they've been going through over the last 6 months or so. And we are collecting that data at the moment. So if you haven't shared our dad survey, please do. I'll right at the end of this event, I'll share links and I'll send that through to you. But if you can share it as far as and wide as possible, that'd be great. And that data really does help people like Hugh and people in the Scottish Government understand what's going on and what's going on with dads. So it's really invaluable. So I think that's it from me. As I said, I was going to be really short. So I'm going to pass back to Chris now, who I think is going to chair the next section of the event. So I'm just going to share my screen.
Okay, thank you, Cathy. So yeah, this last part here is really the chance for you all to ask everybody that's contributed today, everyone that's spoken, all the panelists and Hugh, any questions that you might have. Now, I suppose looking at the questions that have been asked so far today, looking at the conversation that is happening on the chat function at the moment, it seems that there are some key themes that are emerging from today's conversation. One clear key theme around systems and processes in terms of, in particular, information, how we collect information, or what information we do collect, what information we don't collect, how our systems are probably not helping us collect the information that we think we need around where our family members. And there's also a couple of themes emerging around, it's not just about processes and systems, it's about confidence and awareness. And obviously, again, in the chat function, there's been a lot of reference to the sort of learning opportunities that are out there to support staff to feel more confident, to think about and to begin conversations in relation to supporting partners and thinking about paternal and partner mental health. And Michelle and her colleagues obviously have this understanding paternal mental health opportunity in the Greater Glasgow area that staff can access to help with this issue. And then finally, I guess the key theme that's coming through loud and clear from today is around the importance of relationships, of networking, of talking across services, across sectors, which is clearly what's happening in Glasgow. And we do have a sort of it seems to be an almost systemic approach to how we talk to each other in Greater Glasgow, which is a fantastic thing. So I'm now going to ask Cathy if there are any questions on Mentimeter. If not, I have a question for the panelists, and anybody who's been contributed today, feel free to jump in. I guess it's on the face of it a simple question, but nothing ever is all that simple in this world. So in terms of what we've been speaking about today, in terms of the challenges and the issues and the opportunities, from your perspective, this is to the panelists, realistically, what small, simple steps can we take in Greater Glasgow to move this agenda forward, to build on the great work that we've heard about today? What do you think we could do collectively to address some of these concerns that we have? Any thoughts from the panelists?
I think even really simple things like even at, like, for example, in the ward when we're doing handovers or in meetings and things, not just saying mum's name or baby's name, saying mum and dad and baby's name or partner's name, so that everybody, we're always kind of mindful of the whole family and not just the people that we can see in the ward all the time. So just something simple as including their name in conversations all the time. So they're always kind of at the forefront.
And how would you make sure that those things are being asked, Karen? How would you make sure that it's we've spoken already, I think, about some of the sort of champions that we have in our wards and across our services who get the importance of this work and who promote this work. But how do we make sure, how would you think we could make sure that it's a universal approach that all staff have in settings like yours and other places to ask those questions? What would help that, do you think?
So one kind of change we've made recently is just something so simple as like the templates and the forms that we use, just making a space for the dad or the partner's name. So that is, again, just keeping them at the forefront of everybody's mind. So it's just really, really simple things, I think. Yeah, and that's kind of always kind of brings them back into the conversation.
Absolutely, yeah. So just so it's a prompt. It's not actually part of the process, I guess. So anyone else in the panel have any thoughts on anything that we're talking about in relation to how we move forward positively in Greater Glasgow, building on the work that's already been done? Any thoughts from any of our colleagues in the third sector in relation to what do you think, what do you need, what does your organisation need to be able to build on the work that you've been doing?
I think part of what we need is a sort of a unified approach with a list of what we feel needs to be done in short, medium and long term. I think we've discussed the forms, for example. When I speak to dads and their experience, for instance, of certain services, the services are not consistent, and that might be whether that's down to forms, years of experience or lack of experience, maybe, I don't know. But I think there needs to be a coherence in the services on how dad is treated, because it still comes, I think some areas do well and others less well. And I think in terms of what us providing, yeah, we're looking at a best guidelines practice as part of our promise response. And I'm just thinking a lot of that work is relevant to the broader statutory and health services. And we have included that, but it's how do we then move forward? Do we need champions? And that's something we've thought of, someone who can champion that in various pilot projects and see how we can go ahead and bring about a coherence and almost a unified approach to dads. And I think there's a lot of, I think there's still this thing of, well, we're not sure what to do with dads. What do we do with them? And what could come out of left field, as it were. So I think in terms of third sector, I think a sort of a unified approach and sort of a voice saying, what is it we feel, not only what we feel we need, but what have the dads told us? We're speaking to a lot of dads, diverse backgrounds and experience. And we can collate that and say, look, this is a baseline that we need to, that we want to see implemented and that see it grow from there.
That's a really important point, Doug, and I think that it's probably the most important point We're mainly here today as people that work for services, that deliver services to families and to mums, infants and dads. But ultimately, it's the voices of families, it's the voices of dads and of mums. And we're trying to kind of understand the voices of infants as well, in terms of where they are, what they need and how we respond to that. That should be our guide. And that's maybe an action for today, I suppose, is to think about how we can do something more specific around that in the Greater Glasgow area. How can we really make sure that dad's voices and the voices of the whole family are being heard, and how can we respond to that? So I see Jane and Thomas have their hands up. So I'm going to you first, Jane, if that's okay.
Yeah, I mean, I totally agree with what you're saying, Doug. And two things really. I was thinking about the stigma and how do we raise awareness within the communities and with families. And I've seen a few comments about sharing surveys, and like the film that you showed, you know, I think dads generally would, you know, really appreciate seeing those things, and as well as the rest of the families. But so I think there needs to be sort of more public campaigning. But I was also thinking about how we've got together as a panel in order, you know, for this event and coming together today. And, you know, for me, setting up a new service, it's really helpful to join up specifically about this as well. And I would really like the opportunity to do that going forward. And I think there's been ideas about that, but I think it would really help, you know, working in collaboration together to support each other in the challenges.
Absolutely, Jane. And today is, I suppose, today is just a sort of chance for us all to kind of pause and reflect and consolidate on the work that we've been doing. But it certainly shouldn't be a one-off in terms of how we've done this. You know, how we've spoken with each other and communicated and shared what we're doing and how we can work forward together. So it sounds as though we need to have some, maybe a little plan that kind of puts that puts these conversations more formally into place over the next wee while, and see how we can take them forward more directly. So Thomas, you've got your hand up.
Just on that, Chris, it sounds like Fathers Network Scotland had the idea of people to help with that plan A and to perhaps lead that plan. So that's good. Looks like you've volunteered for that. Thanks for that.
It's quite all right, Thomas. No problem.
I was just going to add about funding. That, you know, there needs to be a focus on funding, long-term funding for the organisations, and I agree with what's been said previously about chat and collaboration, and we need to just keep talking. And it feels like, you know, if we can get it right in a place like Glasgow and Greater Clyde, then again, that's a bit of a model to show off to the rest of Scotland and elsewhere. So yeah, I think we need to just keep the conversation going.
Absolutely, absolutely. So Adele, you've got your hand up as well.
Yeah, I was going to say, I think education is definitely the best way, like educating people, and could start early on, like nursing students, teaching students, medical students, just educating them so that it starts like before they like qualify.
Absolutely, Adele. I think everybody would agree with you there. At the earliest stage possible, we have trained quite a few nursing students, and a couple of weeks ago trained a new cohort of health visitors through here in Fife. And as most of us are when we're studying something, we're a bit like sponges, and we take it in, and it remains with us throughout our practice. So Michelle, you've got your hand up as well.
Yeah, just a few things that are coming through in the chat in terms of, and again, linking into what Adele says and Jane's been saying in terms of maybe that public, you know, campaigning response. And it's certainly something I've been thinking about and was going to touch base with some of maybe our dads organisations and maybe some of our LGBT colleagues as well, in terms of maybe some sort of resource out there of just, you know, to help raise awareness of, you know, this agenda. And I think I put in the chat earlier on from one of our training last week, during the break, one of the participants came back and said, you know what, I phoned a colleague and asked her to look round our organisation, you know, the environment, and we haven't got anything about dads and partners, and we're an organisation that's working with dads and partners. So again, it's those very sort of simple changes that, you know, can have the biggest impact as well. And it's a start.
Yeah, thanks, Michelle. And Hugh, you've got your hand up as well.
Yeah, thanks to everybody who's spoken. There's a few things there for me to think about. I think just the two things I would say about what to do from here. I mean, in terms of funding, we're certainly looking at, you know, even within our programme, we can't sort out third sector funding as a whole. I wish we could, but we can't. But we can see what we can do for in terms of the programme itself and how funding is allocated. I should say, and I go back to influencing the new mental health strategy, it is I was at an event this week and the minister was talking about getting away again from year on year funding. So I think any lobbying around that is probably, it's a good time. And I would say that as a whole, if there's a seriousness to progress a new mental health strategy, which has, you know, looking at prevention at its core, then everything we've talked about today is at the core of that. So I would really urge you to, you know, to some extent, this work has been a wee bit under a bushel, and I think it's time to sort of really shout about all of the perinatal and infant mental health work that's been happening and get people on board.
Great, thanks, Hugh. And I think that's probably a call to action for all of us that are here today, and kind of summarises to an extent some of the points that have been getting made over the past half hour or so, in terms of where do we go from here in Greater Glasgow. And I think it really is about trying to formalise the conversation that we're having today, putting it down in paper, as it were, and recording and being clear about what it is we want to do next, how we're going to do that, and how we can measure that in the Greater Glasgow area as well. So we are almost out of time. A few questions have been coming through on Mentimeter, and we're not going to be able to get through the questions, unfortunately. What I will do is we will put the questions out to the panellists by email, and if any of the panellists have anything in response to those questions, we can collate those responses and share them with everyone that's here today. But there is one question that I think we should ask the panel. Today has been about Greater Glasgow and the work that's been going on in Greater Glasgow, and that we want to continue to build on in Greater Glasgow. But it's not just about Glasgow. Today is also about, well, what can we learn from one health board area? I guess it's the biggest health board area in Scotland, probably the most complex in terms of the demographics and the geography and all that sort of different type of thing. But what can the rest of Scotland learn from what's happening in Greater Glasgow? So somebody has asked, what one piece of advice would any of the panellists give to other clinical teams around the country wanting to start to make their services more inclusive for fathers? So all the panellists that have spoken today, what's the one thing you would share with colleagues across Scotland about how to make clinical services more father inclusive? And this is for everyone that's been talking from a third sector and an NHS perspective. So over to you, panel. What would you say to anyone that wanted that one bit of advice? What has really worked for you?
I was going to say, Chris, I think persistence and patience, things don't happen overnight, and don't give up. You know, I don't mean it's worth fighting for, but we're all, that old cliche, we're all in this together. But I think, you know, the bodies that are here today show the passion and enthusiasm for supporting dads, and we just need to keep working forward with that.
Absolutely. Nikki, persistent.
Yeah. Sorry,
Jean, on you go.
Yeah, I was just going to say, Chris, I was reminded of when you came to our induction and, you know, we were thinking about how we were going to roll out our service. And I guess what you really reminded me is you know, it's the ordinary everyday sort of staying curious as you would do, you know, with a mum, that actually it doesn't have to be a huge thing, but just including dads in your first appointments and asking the questions and like, how are you? How are you feeling? How are you feeling about your relationship? So, you know, there is huge work to do, but also I think if we can take those small steps, that will have a really big impact.
I think maybe I would say knowing your context, and I think, you know, wherever you are in Scotland, you hopefully do know your context quite well, because what might work in the south of Glasgow might not work in Stornoway, for example. So understanding your context and drawing from as many sources as you can to provide a service, and if it doesn't work, try and understand why it didn't work, and that'll probably show you from your failure, if it happens, not wishing it on anyone, but you know, we will be able to highlight where we actually may have not thought correctly. And I think, you know, being willing to try that, and if it works, great. If it doesn't work, how do we learn from that?
Thanks, Doug. Hugh, you've got your hand up.
Yeah, Jane and all of our colleagues in infant mental health have taught me an enormous amount around this, and I'm still learning, but what I have learned is that if you start with the infant, with the baby at the centre of this, then rather than, dare I say it, you know, what's the mum's needs, then it all becomes really clear how you deliver a service that meets the needs of everybody in the family. So that would be my key thing.
Absolutely. Yeah.
Sorry, I was going to say, I think as well, not making decisions between your clinical colleagues all the time and not all just going with the systems, but actually taking the lead from the dads and the families and the mums and really listening to what they want and what they need and making processes from that instead of making a processing system first, and then trying to fit them into it. So I think it's just really listening to what actually they need and they want.
Thanks, Karen. Okay. Anybody else on the panel have anything else that you would like to add to what's already been said about what you would share with colleagues across Scotland about what really works?
Chris, I think just from my sort of experience and coming into the sort of mental health improvement team and picking up this area of work, what I'd found is, you know, going out and connecting with partners is often maybe organisations maybe wouldn't badge themselves or see themselves as, you know, perinatal or offering or providing support during that period when actually they were, you know, I'd say, well, are you in contact with new and expectant parents? Well, yeah, providing support. And I suppose sometimes it's language we use as well. And again, I suppose it's that message of if you are in contact with new and expectant parents, then you have a role to play and, you know, offering support during that time.
Absolutely. Thanks, Michelle. Anybody else from the panel who would like to add anything before we sort of round off the morning? No? Okay, so that's fine. So I think just, I think those points that we finished off with there, Hugh's point about placing the infant at the centre of our focus, and then Karen talking about, rather than sort of trying to constantly make decisions between ourselves as services, focusing on the family, focusing on the infant, on the mum, on the dad, whoever it is that's in that family unit. I guess that's probably the best place to finish off today. That's really what we're trying to do today. We're trying to think about how we're building services around the needs of infants at the centre of our services, and who are those wider family members? How do we connect with them? How do we talk with them? How do we know who they are? How do we record and measure ourselves against our work with that wider family unit? Cathy has put in the chat section a link to an evaluation form. If you don't mind clicking on that and just telling us what you thought about the day, what worked well, what maybe could have worked a bit better, but also it'll give you the chance to maybe ask some questions or make some points that you haven't had the chance to make today. So listen, it's a couple of minutes after we were supposed to finish, and that's not too bad, 3 or 4 minutes beyond time. I'd just like to say thank you so much to everybody for coming along today, for participating, for listening to the speakers, to the panelists, asking your questions, and it's been a really active chat room. We will record all that information and share it back out with you. I'd really like to thank all our panelists, all our speakers today for taking the time to put your thoughts together and to share the work that you've been doing and your thoughts on where we can go, where we can build from in the Greater Glasgow area. There is a lot of fantastic work happening in Greater Glasgow, and there's a lot of fantastic work happening across Scotland, all across Scotland. And just to kind of, I suppose, finish off from today, one thing that Michelle mentioned earlier, it's about taking those pockets of great work and making those pockets common practice and universal. And there's a great opportunity for us to build on this work today and to take it forward. So we shall certainly be doing that in the Greater Glasgow area. So there we are. I think that's, oh, sorry, I should say, yes, Cathy's mentioned a huge thank you to Meg from Inspiring Scotland, who's been helping behind the scenes. Inspiring Scotland have been fantastic. If it wasn't for them, I think Cathy and I would have had a nervous breakdown before today when it comes to, you know, organising big online seminars with Mentimeter and things like that. Apparently the evaluation is not accepting today's date. I'm not sure why that is, but if the evaluation isn't working, we'll send it out to you again via email. So anyway, just to say, thanks again so much for today. Let's build on what we've spoken about today. Let's nail down some key actions going forward. And it's all about small changes. It's not about rocket science. It's small, simple steps that will make the big difference. So thanks again and enjoy the rest of your day and your week.